Sure, of course. This is also a very interesting, interesting topic. So in last ASH, we presented a new machine learning model to risk stratify patients with MDS. So this model is, its intention is was to be NGS free, because there are many parts of the world where you don't have access to NGS technology, and at least you don't have it in a timely fashion. So the idea was to take the full granularity of the data, basic data, mostly hemogram data, but also cytogenetics and also gender and some clinical variables. And we ended up with a model based on just 8 variables that could predict both overall survival and leukemia-free survival with very reasonable capacity over the standard revised AIPSS score. Nowadays, we also know that at least for overall survival, the performance is very similar to that of the molecular AIPSS score, even though we are not incorporating NGS tools, but because we are analyzing hemogram data and blood cell count data with a full granularity. We don't do thresholding, we just count what we find and make a model with that. And so the next question was, is this applicable to patients with chronic myelomonocytic leukemia, which is a related condition, but it obviously has different biological characteristics. So we took the data from the same registry, the Spanish group of MDS, who did a great job with this huge registry, and we just applied the model to evaluate how it could risk stratify patients with overall survival and leukemia transformation. And the performance is brilliant. It is also superior to revised AIPSS in these patients. But then we wanted to evaluate what about the CPSS and the CPSS, the molecular CPSS, which are scores that were developed specifically for patients with CMML. And we established a collaboration with a fellow from Taiwan, and we analyzed a Taiwanese cohort of patients who had full annotation to calculate all the scores, the CPSS, the CPSS-Molecular, and also the AIPSS-MDS. And to our surprise, we've observed that a direct prediction with a Spanish trained model into the Taiwanese cohort was superior, both in terms of overall survival and in terms of leukemia transformation to the CPSS and also the molecular CPSS score. So very promising data to increase the availability of, particularly of those countries who don't have access to NGS, to high precision, to prognostic tools which have high precision, and also very interesting to think about possible combinations with NGS data of this model in the future.